NHS travel and transport accounts for a significant share of emissions, from staff commutes and patient travel to ambulance fleets and logistics. This session will explore sustainable solutions such as electric ambulances, low emission fleets, active travel initiatives, improved public transport access, telemedicine enabled care, and smarter logistics. We've got Jonathan Guppy from South Central Ambulance Service, NHSFT. Welcome, Jonathan.
Hello, thanks for having me.
We've got Haroran Hussain from the North East and Yorkshire region. Welcome, Haroran. Thank you for joining us. And we have Sam Goss from the County Durham and Darlington NHS Foundation Trust. Welcome, Sam. Thank you. Thank you so much for being with us. And this is going to be, I guess, oh gosh, I think this is going to be an interesting topic because I think there's so many different ideas, initiatives out there. But I think probably what people want to know is what's working, what's not working, and a bit of that shared practice ideas as well. So Sam, I'm gonna start with you first, if that's okay. Let's talk about challenges, because I want to get the negativity stuff out of the way first, and then we go to the positive stuff. So what have been the challenges when it comes to travel options in the NHS? Is it staff? Is it patient? What in your world has been the biggest headache?
So yeah, I think the many different levels to this. So we're quite a large trust, sort of semi-rural. We have familiar challenges. Bus routes, infrastructure isn't great, not always the most reliable. And if you look at it purely from a kind of, an active travel point of view, active travel routes, cycling, walking, they're not always accessible either. So we then tend to default to single person car journeys. And that just tends to be, the norm. I think in our trust, it's around 70% of our staff commute single person car. And I think that's fairly consistent across the NHS. So that's a real challenge. I mean, if you look at the other thing, staff work shifts, how can you move and develop public transport around those shift times? I think that's a real challenge that we find from our staff when they feed back to us in travel surveys. They are keen to look at options, but it has to work for them.
It does. You're right. It has to. I think that it's the same with everyone. I would happily use more buses and stuff if I knew for absolute definite it was going to work. And when you've got the job on the line and you've got patient care, this is going to be a huge factor. And you mentioned there about your NHS is quite rural as well. It can't be fair to compare your trust to an inner London trust, for instance, on travel, surely.
And I think that again, that's a real challenge. I mean, if you look certainly in the northeast where I work, you might have a trust such as Newcastle, which it's more urban. There are more travel options for staff in terms of kind of metro, buses, trains. If you look at our trust, it does have a couple of urban centres, but a lot of our staff work out in more rural, live out in more rural areas. So just the options and the ability for them to get into ours, it's limited. And then imagine you're waiting for a bus and it doesn't turn up. So these are all the practical things that we have to look at. But there are solutions. They're just perhaps not as straightforward as those that might present themselves in urban areas.
I think this is an area that I would find the most difficult. I like solutions, and I like definite solutions. And I think you guys, with all, you must, again, Haroran, I don't know how you do it, because what about for you? What have been the challenges when you're trying to implement these new travel and transport initiatives? What's been the main challenge for you?
I'm going to go back one step prior to that. It's okay. It's that actually car parking is a real issue in hospital sites.
Yeah.
And if you look at the data on complaints, vast majority of the hospitals top their complaints list with car parking issues. So that's just looking at that. So yes, everybody drives, and there is a consequence of everybody driving, and it's not one hospital; it's up and down the country. And car parking spaces are a premium. They cost money. They're in a prime piece of real estate. And they cost money, but actually there are solutions, and there are positive and worked up solutions, examples available up and down the country. And there are other opportunities as well. And I want to mention that DfT last year have started piloting a subsidised bus service for areas that aren't well served by bus routes. So, and that's sort of like an on demand. So you can actually register and find out either when the buses are running on the day or book yourself. And that's open to staff as well as patients. So if
Okay.
you're in a rural service, area that you can't get a regular bus, just go up. That's why I was looking at my other screen to remember what it was. But it's definitely DFT and it's definitely subsidised bus services, and it costs £2. And often, often that's cheaper than trying to drive and pay for parking. So there are issues and there are things, and I think we're at the beginning of our journey. So we've only been working on this a few years now. So it
Yeah.
would be good, and it would be good for people to share where things have worked and share where things haven't worked. I know in Leeds, the combined mayoral authority started putting on sort of, really fancy bus stops. So bus stops where it's comfortable. Oh my God, can you believe that? Bus stops where you can charge your phone, bus stop
Oh,
with real live information. And I'm pretty sure the other mayoral authority are either doing it or looking at something like that.
yeah.
And I'm going to say, reach out to your local authority, reach out to your combined authority or mayoral authority, and just and start talking to the bus service providers. And I know train isn't as widely available, but if there's a train service local to you,
Yeah.
start talking to the provider and see what they can do. We know First Bus have done stuff, Transdev have done, National Express have done. All of these are companies that we've already worked with and actually come up with really decent, really positive projects and initiatives that has worked. I'm going to name drop another one, which is York and Scarborough. They've done loads of work with their local bus service. Again, reach out if you've got something in mind. Reach
Yeah.
out to us. My email address is that, as you see my name spelled, with nhs.net.
Do you think that we need to stop looking at the NHS as a consumer and start working with the NHS as a partner more? Because I feel like that, we talk about, you mentioned there, Howard, about being a partnership with local authorities. I said this has got to be one of the most prioritized areas of work areas. It will be the fact that 1 in 7 people will be employed by the NHS. So why the hell are we not doing more to help the staff? It's our health, it's our people. I don't know. This is why I can't work in public transport. I'm gonna.
So may I come in? So and I'm going to build on that by saying amazing numbers. So when you start talking to the bus service providers or your local authority, where we are anchor organizations, we're large employers in any town, city or area, and we employ people in thousands. So bus services will come out and will want to work with us because we offer them customers effectively, and not just in terms of patients, but our staff as well. My local hospital trust employs 10,000 people. So when I contacted my local bus service provider, I said, "There's 10,000 people in this building. What are you going to do? To try." Because we can advertise, and we can advertise for the bus service, i.e., this service is available. What is the bus service going to put on for us to be able to do that? So don't feel like you need lots of money and you have to have lots of resources to work with in that partnership. Reach out to them. And often what I've found in my experience is that local authorities don't know who to contact. So they might send, or the bus service providers, they might send a generic email saying, "We'd like to talk to you about somebody," to the one person or the 2 email address they know in that trust, but not necessarily know the right person. And eventually it might take 3 years before it eventually filters down to the person who's dealing with staff travel or patient travel. And it's you'd think it's logically we know exactly, but it isn't. It's we're large employers. A name drop Leeds employed 20,000 people. Bus service providers bite their hands off when I said to them, I said, "What are you going to do outside the hospital tours?" They're like, "Well, how many bus stops do you want?" They were offering to book whatever we want.
No one says no to you, Harwan, though. I feel like you've got the, you're like, oh, I want this. They go, okay. Maybe we just need you to just do the whole of everything.
Yeah, do you know what? We have the numbers, we have the communication. We can communicate to our staff relatively easily. We can put information on our patient appointment letters. You know, we have websites that are, you know, relatively well kept. So
Yeah.
we have lots of, you know, abilities, and don't undersell ourselves, and don't think we need millions of pounds to do something. Just go ahead, reach out and see what we can work together better.
I love
Just
that.
just on that point,
Yeah.
just to build on what Warren said there. So we've been actively working in our region. The North East Combined Authority has been leading a bus service improvement piece of work, working with the anchor institutions and large NHS trusts, local authorities, university. So we've done a lot of surveying through that using a consultancy, and it's given us some real data on where people are travelling from, where they're travelling to, their times of work, that kind of thing. And that's actually being matched now with the bus service operators to try and look at evolving and improving the bus timetable. So that's an active piece of work. And yeah, partnerships are absolutely crucial. We've actually engaged with the local authority, and as part of this piece of work, we're going to be having bus information screens in one of our hospitals, so patients can actually see, and staff, rather than having to walk to the bus stop and find that the bus hasn't turned up, or they can actually find out in the hospital that the bus is where it is, exactly where it is en route, how far away it is, whether it's on time. So these things are, we work at very, very key. We'll see in a year or so whether these things are having an impact. But yeah, active partnership working is absolutely key.
And if you don't, this is exactly it. If you don't know, you don't know. So if if you don't know the information, how are you supposed to know? So if the more we can inform, and again, we said this in the first panel, I think the public I think there needs to be a bit more of an awareness as well for the, to tell the public of what's actually going on. So they have a duty of care as well. Because at the moment, they'll always do the same thing because that's all they know. But if they don't, it's like Harwan's she's like, I love it when Harwan's nodding with me. Then I know I'm onto a good point. Right, I'm going to move on to Jonathan because otherwise we're going to talk a lot about travel and transport. We want to talk about ambulances, Jonathan, because they're going electric. So tell us all about it, the electric. Why was it so important to meet sustainability targets, and how is that going? Tell us all about it.
Well, thank you. So essentially for our carbon emissions footprint, transport is 80% of that. So if we're going to do anything to tackle our carbon footprint, we have to decarbonise our transport. And obviously we've got these diesel ambulances, which diesel is the most polluting vehicle you can have. There's lots of particulate pollution. So it's not just the carbon emissions, it's all the air pollution that we also cause. So it's quite ironic. We're a healthcare provider, but we're actually one of the largest polluters in our regions across the UK. All the ambulance trusts are in the same position. And particularly outside acutes as well, where typically the vehicles will be idling, and they have to idle in order to keep the key systems on board running. So if they haven't got access to a shoreline, then they need to keep those engines running. And when an engine is idling, that's when it's at its most polluting. And that's in an area where patients are at their most vulnerable. So it's something that we really want to tackle just to help with the health of our patients. But also there's a financial imperative as well, because we know that electric vehicles are cheaper to run. So not just in terms of fuel, there's obviously a saving there as well. Despite the 3p a mile that's been introduced, there's still massive savings to be had. And the maintenance side of things as well is far, far cheaper. So there's going to be far lower rates of vehicles being off road. There's far fewer parts to go wrong. So there's two really big advantages financially. There's a lower fuel cost, lower maintenance cost. And so that's a massive driver for us. And it's really exciting that the NHS is actually going to be, we've already got electric ambulances running in London, and the NHS was the world's first healthcare organisation to start running dedicated electric ambulances. And we're now moving into bespoke ground-up ambulances that have been built and designed from the ground up rather than just doing chassis conversions. So this is an area that's moving very quickly. It's very exciting. Obviously, London was the first trust to start running electric ambulances last January, and then down in South Central as well, we're going to start acquiring ours very, very soon. So in the next couple of months, we're going to start to see the rollout, and obviously totally different geographical footprint to London. So we're quite rural, quite distributed. We've got a few urban centres. So we're very much looking forward to seeing how they perform. there are questions that arise.
Yeah,
We know.
I've got a question. I've got some questions about charging and all sorts, and electricity, and enough charge points, which I know you're probably going to just answer.
Yeah. So the key, I suppose, the key constraint is the availability of charge points and charging facilities, and that's something that we're working on. So, as a trust, at the moment we've got 33 fully electric vehicles at the moment on our books. It's not a huge number, but we've got nearly 90 charge points available already, and we're rolling those out. So we're trying to make sure the distribution and deployment of charge points is ahead of the curve in terms of the rollout of fleet, because it's not a chicken and egg situation. We need to have the charge points in place first, really, before we get the vehicles, so we can ensure that we can charge them. And there are also concerns about battery range as well. That's something that keeps cropping up. But we know that the median journey for ambulances is about 92 miles, and in a 12-hour shift, that is. And we know that the range of the batteries for the first generation of vehicles we're getting is just around about 100 miles. So typically, in a shift, it's going to be quite tight, but without having to stop during the shift, a single charge should actually perform a full shift in most cases. So all we need to do is just allow our vehicles to have a top-up charge during that 12 hours. And for the majority of times, the engines are actually switched off in these vehicles anyway. So there's lots of opportunity to charge during a shift. And we're not talking about a full charge, just a top-up, 30 minutes here, 20 minutes there. So that's why we need to have lots of charge points all over the place, including outside the hospitals as well. That's something that we're liaising with our partners, the emergency departments in our area, to start rolling out that infrastructure as well.
And using that circular energy in the hospital approach, so you're not, draining. It's always everything reusable. What about, can you use like a mix of hydrogen fuel ambulances as well, or biogas or something as well as electric? Is that an option as well?
We've looked at that. It's obviously something that people have thought of, but hydrogen is extremely expensive, and there's no real availability of it in the UK. And the the previous administration drew up a hydrogen strategy, and the current government seems to be running with the same strategy. And they're not envisaging hydrogen for use in mass transportation. It's seen as something to use where you can't electrify. So the national strategy is to electrify first, and if that's not feasible, then consider hydrogen. So sectors such as heavy goods vehicles, for example, construction, agriculture, shipping. So those are sorts of sectors where it's hard to electrify. And we know this from the way hydrogen is made. The starting point is electricity. So the hydrogen is always going to be more expensive than electricity, and there are difficulties with the transportation, distribution, storage of hydrogen as well. So it's something that has been considered and looked at, but there's no real move towards that at all in our sector, and that lines up the general automotive industry's position on this as well.
I'm going to come in just a bit about hydrogen. So it isn't in the no. Let's take it back. So anybody in and around West Yorkshire, there is a hydrogen fuel cell station being built at the moment. So if you're interested in hydrogen and just want to explore it, don't worry, nobody's asking you to sign up for it yet, but just explore it for your fleet, for your vehicles, for whatever. That there is a station or going up in West Yorkshire. So please do get in touch, and I'll connect you up with the people who are building it as we speak. So they've had the planning application accepted, and they're looking at building the actual fuel station, I think, or fuel cell station. So there is an opportunity there. I think my worry is that, because of previous government and current government's policy, that we're definitely going down the electricity route, and that's okay. But the governments know better, and they're looking at it as a nation rather than me, looking at it as a thing. But the alternatives, and there will be, as we know, with any change, you try 2 or 3 different things, and the one thing that sticks is the thing that sticks really. So there are opportunities, and there are. I'm aware of 2 other hydrogen sort of plants. So I know of at least 3 plants that are in and around available in northeastern Yorkshire region. So yeah, please do contact me if you are interested in that. I mean, there's quite a lot of question on the.
There were lots of questions coming in. I'm just looking through them now, and I think but this just shows, doesn't it? It's like people want to do something, but like I said, there's all these like, but what about this? But what about that? And you're right. Well, I remember you were saying this earlier, Haran. We're still at the early stages, aren't we? It's still like, you said 2-3 years that we're really starting to think about it, and it's not going to happen overnight, unfortunately. I mean, you can't just have a magic wand. I've always said this: I want a magic wand, but I can't have one. So it's trying to get these kind of like people's. The thing is that it's a good thing that people are questioning, right? So we've got all these questions like, well, what about this? Well, what about that? So people are thinking, aren't they? And if they're thinking like that, what can I do? What can we do? But this and this, then that means there can be solutions from it, right? So if we're asking the questions, that means people care and we can do something about it, right?
So just want to say, I've just literally seen somebody saying, what about disposal of batteries? That's already been looked at. I don't know if there is any place in England, but I know there's a massive power plant in Paris or on the outskirts of Paris that are looking at batteries. And it's not going to be a case of, it's not like the bad old days or the good old days where, you used up your battery and you bin them. These are large batteries. There are people and, manufacturers who are already and have been for years looking at it and looking at how to make better use of it, how to make them more efficient, and how to, what to do with them at the end of their life in a vehicle. So there will be other uses, and I do know that there is a massive power plant outside of Paris who are looking at recycling the batteries from the current vehicles that we're using. I couldn't name you just because
Mercedes have opened a big recycling plant in Germany now as well, where for their vehicle batteries, and we're looking at 98-99% recovery of the materials. At the end of the day, the battery is one of the most expensive items of a vehicle, and and they haven't been allowed to go to landfill for quite some years now either. So, and even when they've reached the end of their useful life in a vehicle, they can be redeployed for battery storage for another 10-15 years before they do need to be recycled and remanufactured back into new batteries. And so in the UK as well, there's lots of recycling facilities are now gearing up to do battery recycling generally, because of all the lithium-ion batteries that are in lots of consumer goods, and also as vehicles come towards the end of their life, because obviously quite early so in the life cycle of a lot of EVs, those are going to start feeding through into it as well. So so an EV battery has 2 lives, one in the vehicle and then as battery energy storage system, and then it can be recycled back into another battery all over again.
So I think that we're starting the process, right? We're starting with people to think about different options and different ways, and we are making the changes where we can. And like I say, batteries and recycling, that's sometimes out of our hands, but we can only do what we can do. Now we've got these big targets, 2040 to be, sort of net zero and everything like this. So I'm sort of in my head thinking of in the future, which is not that long away. Will we get to a point where a hospital will be, you can only get close if you are really, really sick, ill, you know what I mean? Just trying to get, they're the only people that can get really close. We'll have like these electric sort of hub, sort of transports coming in, and people, there's like 24/7 transport service for staff and patients. Do you think we'll get to that? Am I going too futuristic, or Sam, should I just stop?
Well, I've got this kind of vision of kind of flying electric cars and stuff like that. But, I guess if you look back 25 years, you wouldn't have thought that, a lot of the technology that exists today would exist. So, I mean, who knows what the future holds? But I think technology holds the key to many things. And certainly, the challenges we've got on hospital sites at the moment are manyfold. I mean, we've got huge challenges around car parking, spaces that are at a premium, as everything we tend to do to try and discourage and encourage other options. Do they always work? I'm not so sure. So how can we actually, move care away from hospitals? And I think that really has to be at the heart of where we go with this. So, we look at the NHS's digital strategy. You look at things like virtual appointments, and just, a lot of patients who come into hospital don't actually need to come in. And
Yeah.
I think that has to be at the heart of what we do going forward, just to decrease the demand on travel into hospitals. But it has to be done in an equitable way, because, you know, there are other factors involved in that. So, yeah, I think that, to me, technology and digital is a key going forward.
There's only so much technology can do. You know, it can't fix our mindset of, you know, do we really need this? Do I really need to make that travel? Do I really need to do, you know, all these little things? It's a culture shift as well, isn't it? And I think this is what I think is going to be a huge message, a takeaway from today. But then it comes back to that information, you know, making people aware of what is going on and how. And I know you're going to be like this. I'm sure everyone knows what you're doing as well. But it's true, isn't it? And this is, if people don't know, then they don't know. And if we can just keep talking about it, telling people the options, telling the good work that you're doing, all of the initiatives that are out there, the options as well. I don't think people really know what options there are as well. Because again, it's like there's that personal responsibility, isn't it? So I don't know. I am being a little bit too.
I think it's a social societal thing.
Yeah.
And my mother, you know, she will not believe if I have an online triage for her. She has to be seen by somebody for her to be triaged. You know, she can't do a telephone triage. She's like, well, you know, you've just had a chat with somebody. I want a doctor. You know, and that's my mother. While I'm quite fair with that, and my children would be very different. You know, they're not going to look to go for a personal appointment or a face-to-face. You know, for them, they'll be busy doing something else. They'll want, and you know, how many people online now has got a smartwatch?
Yeah.
You know, that's just saying something. How do we actually use our phones to its maximum capacity and capability? We don't. So all of those things will have masses of positive impact. There will be some niggles and there will be some negative stuff, but mostly it will be positive impact that technology is taking us down this route. So I think we forget when we're using our mobile and trying to get a GP appointment at 8:30 in the morning, you know, and thinking, actually maybe I could go online using my, say, mobile phone, save myself half an hour of holding on to and just book this appointment. And the GPs, or primary care, I should say, will learn to make better use of their services online, and not necessarily ask people to ring at 8:30 every morning, you know, to get an appointment. So things will change. And I mean, the hospital is so, as a system, it's so carbon intensive, it's so expensive. You know, an overnight stay in a hospital, you're looking at £2,000 cost per person, you know, 15 to £2,000, you know, 1,500. And suddenly you're sort of thinking, well, do I really? And how many people actually want to spend a night in a hospital? You know, I'm not even going to go into hospital food, but you know what I mean? We don't intentionally ever want to go and spend a night in a hospital. We'd far rather be at home. We'd far rather somebody told us what was wrong with us, you know, by us telling them, you know, what we think. Rather, you know, I'm sat here. I would so easily and so quickly choose to have a virtual consultation than actually drive to my local GP or drive to my local hospital, try and find a parking space, try not to complain about it, try and get in there and come out, you know, suddenly 2 hours, 3 hours later, I've just spent what I could have done in 10, 15 minutes. And it seems like that it will change. It will take time, of course, because it's massive. You know, we're looking at structural change to society as we see it, to what is happening with us now. But you know what? We've survived COVID. We can survive changing appointment system.